Today I'm going to be treating the shoulder using the Tecarpuls from Enraf Nonius. We're going into impingement syndromes. You'll see here the machine's going to start at level 9, level 10 is its top level, so it's going to preload the heat. May well need turning down during the treatment. It's pre-selected 5 minutes. I like to go for 1 minute per treatment head size. Obviously if the impingement was just at the front of the shoulder you'd go less time. If it was at the back of the shoulder, you'd go less time. But because I'm going to be doing the whole of the shoulder, I'm actually going to come up here to 7 minutes. Let's have a look at this from the perspective of the treatment. I'll just bring the thermal camera in so we can have a look here. So if we have a look on the thermal camera, you see high 31 degrees, not unusual, pretty normal temperature to start with. We're going to be going from the centre to the back and then right round to the front of the shoulder. Sometimes the impingements are just at the front back. We'll put the contact medium onto the earthing electrode and we'll give that earthing electrode to the patient to hold. There's not a convenient place really to put the earthing electrode, so we'll just let the patient hold it in this case. Add some contact medium to the shoulder. You want enough contact medium that you won't run out during the treatment. It's not unusual for the contact medium to dry out during the treatment, so I tend to go more rather than less, but I'm sure you'll find the amount that works for you in the end. Like I say, if you run out, it'll actually go sticky and you'll find yourself having to stop the treatment to put more contact medium on. I'll spread that contact medium around and then start the treatment. Moving round, in this case, the whole shoulder, and just keep the head moving at a reasonable speed. You don't want to build up too much heat in any one individual area. You'll find that anywhere where there's a bony prominence up near the acromial process, you'll get an increase in heat around the back of the scapula. You'll get an increase in heat as well. If you get an increase in heat in a spot, you can just turn the machine down. You don't want the heat to become stingy. I would describe it as stingy heat. You don't want the heat to become stingy for the patient. So just turn it down if you find the patient's becoming uncomfortably hot. Or if there's just one spot and it's getting hot, you can just avoid that spot for a little while and it'll cool back down. Now, one thing to remember if you're new to using the machine, do keep your finger on the minus, the down button for the output control. If you don't, and you'll see I'm not, you might find that if you need to turn it down, you'll actually stop moving the treatment head and it'll just get really hot underneath the treatment head. In this case, the patient would be able to move away, obviously. But if you've got the patient laying down on the bed, you won't be able to let them just move away if it gets too hot. So do try and keep your finger over the minus button. It's just good practice. For impingements, you'll tend to find in the shoulder that Tecar is better if they're long-standing, not on acute impingements. So I wouldn't use this on an acute impingement in the shoulder. You really want a long-standing impingement in the shoulder before you start using the Tecar on it. If the impingement was just at the front, then obviously I would only be doing the front of the shoulder, and that would look much more like the biceps treatment from one of the other videos. If it was just the back of the shoulder and around the back of the shoulder blade, it would look much more like the trapezius video actually from the neck. The centre of the shoulder, so just in the middle of the shoulder, is where the bursitis treatment is generally done. And again, you want about a minute per treatment head size. You don't want to cover too big of an area with Tecar in one go. You'll see here now that we've got some erythema, some reddening, some flushing of the skin from the treatment and it getting warm. You'll get that if you cover a moderately large area. You see me just turning down the treatment there whilst keeping the treatment head moving. You get that if you cover a moderate area. If you try and go for too big an area, you won't ever build heat up in it. And let's fast forward a little bit now to the end of the treatment, just so you don't have to sit through it all. And we'll bring the thermal camera back in and have a look and see what the temperature has changed by. So looking at the temperature here, and you can probably see that we're in the high 36s, 37 degrees. That's pretty normal for the shoulder.